Good afternoon, and thank you for tuning in for EI Live, the Eisenhower Institute's weekly series providing critical analysis of long-term issues. You can find our past events on YouTube and broadcasting Wednesdays at 11 on 91.1 WZBT Gettysburg. My name is Keely Cassidy. I'm a recent graduate of the class of 2020, and I am joined today with Sarah Madsen, class of 2022, as your EI Live moderators. Our conversation today focuses on the impact of COVID-19's crisis on the prisons and their populations. Over the past several months, experts and advocates have continuously warned about the unique threat posed by the novel coronavirus to incarcerated populations. Today, it is my pleasure to introduce our expert special guest, Celeste Trusty, Pennsylvania State's Policy Director for FAMM, as she joins us to discuss the impact of the coronavirus on prisons and their populations, as well as her organization's efforts to promote compassionate release to protect the vulnerable individuals. FAMM is a national nonpartisan advocacy organization that promotes fair and effective criminal justice policies. We invite you to join the conversation by sharing your questions and comments through Facebook. A graduate from Arizona State University, Celeste also holds a graduate certificate in forensic criminology from the University of Massachusetts Lowell and received her master's from the University of Pennsylvania. Celeste is a lifelong advocate for justice reform. Prior to her work with FAMM, she operated a social justice and criminal justice advocacy blog dedicated to covering justice-related issues, was a lead researcher and assistant producer for a series arc of Undisclosed podcast, and was a volunteer for the Pennsylvania Innocence Project. Celeste previously served as FAMM's regional organizer for Philadelphia. On behalf of the Eisenhower Institute, I would like to take this opportunity to thank Celeste for taking time out of her busy schedule during this unprecedented time to join us today for our discussion on social justice reform. To begin, our first question is, what precedent of disease outbreaks exists among prison populations? What has FAMM learned from past precedent to inform policy recommendations today?
Thank you so much for having me. I really appreciate the opportunity to be here and have this important conversation. So I know in Pennsylvania, there has been a history of, there was a flu outbreak in Pennsylvania's state system, and they had to deal with that. And so they definitely have put in plans and preparations in order to help prepare for a pandemic. However, Pennsylvania's state prison system is large, right? So over the last 30 years or so, our legislature has really built a sentencing structure that has ballooned our prison population. So right now we have about 42,000, 43,000 people in our state prison population. So when you're looking at pandemics and outbreaks and things like that, what we have to do is start reimagining what prisons should look like, and so that we can build in things like social distancing and things that the CDC says can definitely help reduce the transmission of the disease, not only just this disease, but to prepare for anything that might come next.
So our next question is, which groups are most vulnerable or have been impacted by the outbreak of COVID-19?
So the CDC says that older people and people with pre-existing conditions are more vulnerable to the coronavirus. I'm assuming that applies the same way in prisons. When you look at the people inside of prisons, there's actually been studies that show that people in prisons actually age faster, about 10 to 15 years faster than people on the outside. So we have to start looking at when the CDC says people who are 65 or older are most vulnerable, what does that look like about the populations inside prison, right? And then of course you have people with pre-existing health conditions, and our prison medical system might not be set up to really handle a huge outbreak of COVID-19. So far in Pennsylvania, the latest is that we've had 178 positive staff tests of COVID-19, and then 249 positives in the residents. Now, that is definitely out of about 43,000 people. That doesn't necessarily seem like, oh, that's very shocking. However, when you look at the distribution, we're seeing that there are outbreaks in a couple different facilities, and that is what is concerning. We have heard from DOC that they're really trying to implement things to help reduce the outbreak and the spread. So far, there have been 7 people who have lost their lives, and then who live in the prisons, and then 1 staff death. And so I know DOC is really trying to help reduce that spread by using a certain facility to help quarantine folks. They had people locked down for quite a long time and did a lot of in-cell programming and everything to try to reduce the amount of people moving around at once. And so hopefully that did help reduce the transmission and spread of the disease inside the prisons and in the communities as well.
All right, thank you. How has response varied among federal and state prisons? Has FAMM noticed any locations which have been particularly successful in their response?
So the federal system and the state systems are very, very different. Federally, FAMM has really been pushing compassionate release. The BOP has been a little frustrating to deal with. We've heard a lot of horror stories from people who were told that their loved one was going to come home, and then that got taken back. However, FAMM has done a really good job at working with a lot of different law offices and lawyers to do pro bono work in a compassionate release clearinghouse that has helped pair people who are applying for compassionate release in the federal system with pro bono attorneys to help get them out. And so there have been hundreds of motions filed through that. I believe through that clearinghouse, we are up to 18 people who have been granted compassionate release through that project. So that has been wonderful, but of course, that is far too little. We need a much larger response at the federal level through the Bureau of Prisons, through the Department of Justice to get people home who could be quarantining at home as opposed to being left to be exposed in the prisons. At the state system, in Pennsylvania, lots of organizations urged the governor to reprieve people who were vulnerable to COVID-19 during the emergency. I believe it was April 10th, the governor did issue a reprieve order. However, it was actually pretty narrow. We thought originally about 1,800 people would be eligible. Under 200 people, I believe, have actually been granted that reprieve. And so that is a little bit frustrating because we really were hoping that those reprieves would be applied to as many people as possible in order to thin out the prison population and allow people to go home during this as opposed to staying inside the prisons. The DOC has identified 12,000 people in their population who would be vulnerable to COVID, according to the CDC's guidelines. So we're looking at doing what we can do in order to thin out that population in order to stop the spread and mitigate the spread, not only in the prisons, but those communities outside. We have to start finding ways outside of this reprieve program, outside of the limited authority that the DOC has, in order to get people out. That means our legislature has to act. They were given the opportunity to act during COVID. They did not. They have been given the opportunity to act throughout the years on things like medical parole, geriatric parole, clemency reform, and they have not. And so at this point, we need to be leaning on our lawmakers and putting pressure on our lawmakers to find ways to allow people to get a second look at their sentences and be able to, be released in these situations.
A follow-up question, how long does it take for an individual to be granted the reprieval offer that you're speaking about?
So the reprieve they can be implemented pretty quickly. Again, that's kind of because of the criteria. People had to be within, I believe it was 3 and 6 months of release already. They had to have a home plan, things like that. So it seems like they had already kind of been, if you're already ready to be released or close to ready to be released, they can, they could do that with the reprieve. Also, DOC, with whatever limited authority they had, they were able to reduce the prison population. I believe they're down by about 2,500 people since March 1st, which is great. But again, we really need to see a much, much larger effort. The governor does have the authority to reprieve people. He doesn't have to do it based on this limited, the limited things included in the reprieve. So again, with clemency reform, people who are serving life without parole in Pennsylvania, right now they need a unanimous vote through the Board of Pardons to be granted clemency. And that's really their only opportunity for relief. That can take years, and most people just don't even get that approval, right? So reprieves, yes, they were generally very, very, fairly quick. But the process has been slow, and that's the problem. Not enough people have actually been granted those reprieves, even though the reprieves that were granted somewhat quickly.
Why is FAMM advocating for the early release of inmates to combat the spread of COVID-19, and what would the implementation of this policy ideally look like, and who would be eligible? And then we also just want to remind our viewers that we invite you to join the conversation by sharing your questions and comments through Facebook.
So FAMM has pushed for second look and opportunities for people to be granted early release since the beginning of FAMM. That is what FAMM started out doing, right? It was Families Against Mandatory Minimums when it started in the early 80s, trying to find ways for people to not be sentenced to a minimum amount of time, allowing judges to have that discretion to look at an individual and say, you hear the circumstances around your situation, and this is the sentence that would be appropriate to you. And so we have been pushing for those mechanisms to be implemented for decades, right? And so now with COVID, we feel like at this point, people should really be listening to us, right? We have been talking about, thinning up the prison population in a safe way and showing that the evidence shows that you can do this and still have reduced crime rates. There was a report that came out earlier this year called Crime Lines that showed over the last 20 years, we have been able to actually, I believe it's 20 years, to maintain lower crime rates while also decreasing our prison population. I got to double check whether it's 20 years. It might be since 2011. But looking at those things, it really is amazing, right? We have evidence to show that we can do this safely. And when you reduce our prison population, what else does that do? It frees up money that we shouldn't be using on incarcerating people who don't need to be incarcerated anymore, and using that to invest in communities, in things that we absolutely know can reduce crime, can make communities whole, as opposed to tearing families and communities apart, right? And so we've been advocating for this forever, but when you look at COVID, there are people who are in prison who are at risk of, getting COVID-19, dying from COVID-19, and that should not happen, right? If you're in prison, you have a right to having healthcare, adequate healthcare, and as much as our department is really trying to do whatever they can to protect people, they're in a situation that is nearly impossible if you think about it. Again, because our sentencing laws in Pennsylvania have created this gigantic prison system, what are people supposed to do? So we really need to fight to make sure that as many people as possible who are in power have mechanisms to act in these situations. So whether judges are able to act in these situations, whether judges want to be able to look at somebody's sentence after they've served a certain amount of time, COVID or not, right? We need to be looking at mass incarceration as a public health issue. It was a public health issue before COVID-19, and it is a public health issue now. And hey, we are being told that we are going to have a second wave of COVID in the fall. What are we going to do to prepare for that now, right? And again, we need to start realizing that this is not just about the same advocacy groups shouting and screaming to protect people in prison and reduce mass incarceration. This is also about the staff who have to come in every single day, work inside the prisons, leave, go home and see their families, see their grandmothers, go to the grocery store, and then go back into the prisons. And so we really need to understand that people in prison, their health, their well-being also impacts our community's health and our community's well-being. And so we need to be implementing policies that allow people to get parole, get release if they have medical necessity, if they are old, and have that behind them, if they have served a certain amount of time and have redeemed themselves and restored themselves. We see these amazing, amazing examples of that with people like my friend Donnell Drinks, who now works for ACLU-PA protecting elections. George Trudell and Naomi Blunt, who now work for the Lieutenant Governor's office, advocating for people who are also seeking clemency because they were granted that grace through clemency. We have beautiful examples, even in Pennsylvania, of what second chances can look like. And so we need to start implementing policies and, again, forcing our legislature to pay attention to this, pay attention to people in prison, because, again, it's, people can say whatever they want about criminal justice reform, but we have to start realizing that this impacts all of us.
I just have a brief follow-up question. So what's the public opinion generally of compassionate release programs like you mentioned?
So, we're actually starting to see a lot more people coming around to the idea of compassionate release and second look sentencing laws. It really has been interesting over the last decade or so. People are starting to build these nonpartisan and bipartisan coalitions of folks that you might not think would work together on certain issues. However, on this issue, they can see eye to eye because they see what is the benefit to public safety, to taxpayers, of keeping an elderly person in prison when we have data that show that people who are released after age 50 have a very low recidivism rate, right? People who are sick and old, why would we pay to keep them in prison when we could, have them come home? We can save money, we can save lives, we can restore communities. And so it's been great. We've been working with all kinds of organizations and lawmakers from across the political spectrum, community members, faith-based organizations who really see the benefit of second chances and compassionate release.
Fantastic. So to transition to another one of our questions, how has FAMM's policy recommendations using COVID-19 as an opportunity for criminal justice reform? How are you guys looking at this during this period?
Yeah, so again, I think this is a great time for education, right? Educating the public. We have been screaming for criminal justice reform for so long, and so many people just don't listen, right? But now we have to start looking and realizing that my health is wrapped up in your health, my well-being is wrapped up in your well-being, and we are all one societal fabric. And so if we are spending millions and millions and millions and millions of dollars more incarcerating people than we need to, we have to start to reckon with that. We need to start calling on our lawmakers and saying, why are we wasting our money this way when our communities need these resources? I think that money should be spent this way instead. And just holding people accountable for that. But we also need to show people the humanity behind prison walls. And so when I talk about education and public education and lawmaker education, I think right now is a really good time to highlight stories of what it's like to be in prison under lockdown, what it's like for families who have loved ones in prison right now under this lockdown, who have not been able to hug their loved one and have no idea when they will be able to again, right? Not hearing. We have heard horror stories of loved ones who have been calling the federal system, trying to find out where their loved one is and how they're doing, and they don't get the information, or they get the information far later than they need to. These are really things that we need to let people know about. I think part of the issue with criminal justice reform is, people are hidden behind walls in prison. There's a reason for that, right? It's out of sight, out of mind. People do not think about people in prison. And it's difficult. You put somebody in prison, you strip them of their name, you give them a number. That's how they're referred to. We really need to start humanizing the people in prison. If we're terrified out here about what this pandemic is doing to our world, imagine what it's like to be in prison right now and have no idea what's going to happen. Being in a cell, basically on top of another human being, when you know the CDC is saying you need to stay 6 feet away from somebody else. How does it feel to have a loved one who's in prison? How does it feel if you're a child and your mother or your father is in prison right now during this? We really need to start sharing these stories. And I think that FAMM, that's one of the things we really try to focus on is storytelling. Empowering people to share their stories, to share them with their lawmakers. If, as a constituent, your lawmaker, you are their boss. Go and share your story. Say, I am impacted and here is why. Finding every possible way to make sure that we are highlighting these issues, highlighting the good people inside, highlighting how this impacts people, highlighting how this impacts communities.
As a follow-up, in what ways is coronavirus also hindering FAMM's work and everyone's advocacy towards criminal justice reform right now?
Yeah, that's part of the issue, is that right now there's a lot going on with coronavirus. And for a while, we're worried that it was going to suck all of the air out of our issues, right? People might not listen because there's so much going on. And we understand, there are budget shortfalls. People can't pay their bills. People can't afford to eat, right? But we need to understand that criminal justice reform provides savings, right, for our government. People are going to want to find out where their next stimulus check might come from, where their unemployment is going to come from, where their jobs might come from, what their schools are going to look like, what their communities are going to look like. If we are able to save money through reducing mass incarceration, that money could be invested into communities and all those other systems that we know contribute to reducing crime, right? Contribute to having more robust and productive communities, right? And so we just need to reframe this issue and start really pestering our lawmakers. Where do you stand on these issues, right? Educating voters, making sure that people know where their candidates stand on certain issues before they cast that ballot, right? Where do you stand on criminal justice reform? If it's not on your platform, why not? And could you put it there? And here's why, right? So right now is a really, really good time to hold those people accountable, educate the people who make those laws, because, they're there and they want to listen to us right now.
So I just want to take a minute to step back and address a question from the audience. What are FAMM's greatest goals based on long-term issues that they see in the prison system?
So I would have to say one of those biggest goals is second look sentencing. That's a huge umbrella, but when you start to break it down, that basically just means finding ways, and again, mechanisms for every possible person to act in order to find those second chances, right? So we have so many people in Pennsylvania who are serving mandatory life without parole. That means there is no opportunity except for through clemency in order for them to be granted relief. But I have to say, I know so many people who are serving life without parole right now. I meet with them on policy issues. They give such amazing ideas. They have nonprofit organizations inside where they raise money for the communities outside, right? Again, the storytelling. These are the stories that we need to be telling. These are the people that we need to be elevating and finding ways for them to come home. So when you're talking about second look sentencing, that's compassionate release, that's medical parole, geriatric parole, parole reform, allowing people who have shown that they have rehabilitated and are deserving to come home. It would be wonderful, productive community members to have those opportunities. In Pennsylvania, we just don't have those opportunities. There are bills in both the Senate and the House that would change the required vote for clemency, for commutation for people serving life without parole. We need to make sure that our lawmakers, especially in the judiciary committees, allow those bills to be heard. There are bills to end life without parole, and we need to make sure that our judiciary members allow those bills to be heard, because without those bills heard, we're not going to be able to make a difference, because we need those laws in place.
I would now like to transition to another audience question. What can people do to get involved and help with issues of mass incarceration during this period?
So there are a ton of ways to get involved. As everybody knows right now, there is a lot going on about the criminal justice system. There are so many ways to get involved, and I encourage you to get involved, because we need allies on the ground. We need allies on social media. We need allies confronting these problems and naming them as they are, right? So take the time, go online, find the organizations that are doing this work, donate to them, donate your time, donate your resources, share their stories, show up when you need to show up and be active because we need your voices. If you want to get involved in FAMM, you can actually text FAMM to 21333. That'll get you signed up to our emails. We are doing a lot of work at the federal level. We're working in a bunch of different states on all kinds of different things. So we do mostly sentencing reform, but obviously there are all kinds of organizations who are working on the ground to do these great, great things. In Pennsylvania, there's CADB, which is the Coalition to Abolish Death by Incarceration. They are one of the major organizations on the ground who are working with the directly impacted on making sure that people do get second chances and how can we change those laws. ACLU-PA is doing some great, great stuff as well. Amistad Law, Abolitionist Law, all these organizations are doing some really great work. So please take the time, research them, elevate their work. PA Harm Reduction Coalition, make sure you really understand these issues in a visceral way, right? And use whatever opportunities you have to scream it from the rooftops that we need change and tell people why. We need to challenge these systems. So please, I welcome you to challenge these systems. If you want to reach out to me, you can. My email is ctrusty@famm.org. I can keep you updated on all the work we're doing here in Pennsylvania. I do a lot of legislative work, of course. So if you're interested in the things that we're working on, you can look at our website, which we're working on updating on the most recent legislative efforts that we're doing. We constantly put out online actions, petitions, text actions, and really neat ways to get involved. So follow us on social. I believe it's FAMM or FAMM Foundation, and you're able to see all of the work that we're doing all over the country. I really am proud to work for this organization and proud of the work that we're doing here. And so definitely take that time, do the research, and then of course, be an educated voter. If you are able to vote, make sure that you are an educated voter, because the people who work at the Capitol, the people who are the ones writing these laws, they are the ones who need to listen to us. And if you expect someone to go to the Capitol and represent you, they need to know what you want them to represent. And if they don't represent those issues, you need to hold them accountable for that as well. So please make sure you're an educated voter. Again, education is super important. So educate your loved ones, your friends, the public, anybody you can, and just really try to elevate the good people who are behind our prison walls.
Thank you so much. So next, we wanted to turn our attention to everything that's been going on lately in the demonstrations across the US. So in the wake of George Floyd's death, FAMM released a statement today calling attention to racial inequities in the criminal justice system. How has FAMM used these events to better inform their advocacy efforts?
So, and I'm going to really try to keep it together here because it's been a very difficult time. I'm very, very proud of the statement that FAMM put out. We have been fighting for sentencing reform, again, from the beginning. When you're looking at when we started out looking at drug mandatory minimum laws, the sentencing disparities there, the crack disparities, right? The racial inequities that plague our system. Sentencing reform, really, when you look at our criminal justice system and the population and the people who are there, if we are able to find ways to give people second chances, change our sentencing laws, change our practices, again, when we talk about saving money, reinvest in our communities as opposed to finding ways to break them down. Criminal justice reform is so big, and it starts at the very beginning. And when you see racial injustice at every step of the way, you can see why we have such racial inequity in prisons and jails. Because I know, and even, our president, who was formerly incarcerated, he emailed our members and said, he knows that would not happen to him if he tried to pass a fraudulent $20 bill. He would not have had a police officer kneeling on his neck for nearly 9 minutes until he was dead. And he knows that. We all know that, and we all need to confront this and say exactly what that was. You know, George Floyd was executed in broad daylight by a police officer. That is unacceptable on every level. And when we start looking at these issues and talking about these issues, we have to talk about how racial inequities from the very beginning, how people are looked at and treated differently by police. And then once they're arrested, how they're treated differently, often by people in power, then differently at sentencing. This plagues our system from the time a person is born throughout. And we need to start confronting it. And so I am so proud that FAMM is putting out these statements. Again, we have been working on these issues and talking about these issues since the very, very beginning, but this requires a stronger statement at this point. And so, you know, I stand in solidarity with everyone who is impacted by this. My heart is every single day just broken. So we are working very diligently to address these issues, again, through sentencing reform, because that's our lane. But we are working very, very hard. I'm dedicated to this as a person of color. This impacts me on a daily basis. And so I'm committed to it. Our leadership is committed to it. We are absolutely committed to naming the issue and talking about what it is. And so we stand and we mourn with the family of George Floyd as well.
Thank you for such a thoughtful and thought-provoking response on such an incredibly emotional and difficult topic that this nation and every single one of us to different degrees is facing right now. We have time for one more question. So this is an audience question. What responsibilities do governments have to support the basic needs of prisoners once they are released, especially during a pandemic?
So that's actually a really, really fantastic question, and something that doesn't get asked enough, because we do focus so much on the release aspect, but then and so many people, you have to wonder what's going to happen afterward. And so I thank you so much for that question. There are, there are organizations out there that do reentry work that are fantastic. One thing is there is definitely a lack of reentry resources, often in local, in the rural communities, and we have to start looking at that as well. I know in this release effort through COVID, I know the Department of Corrections did really focus on making sure that people were set up with places to live when they left, with access to healthcare when they left, to make sure that they weren't set up for failure, right? However, we really need to do a much better job on the whole, not just during COVID. We need to be supporting people through their incarceration to prep them for release. Most people do get released. And once you're in the system, you need to be getting ready for that release. We need to be providing better educational opportunities. We need to be expanding Pell Grants for incarcerated students to learn, right? We need to be opening opportunities for people so that when they come back, they can be the amazing community members that we know they want to be, right? So that is really, really important. And so again, reentry, there are some amazing coalitions, amazing organizations working on reentry. If you want to donate to them, that is a huge thing as well. Because again, we want to make sure that everybody, when they come home, they do have those resources so that we're not having people worried about where their next meal is going to come from or where they're going to have access to healthcare.
So unfortunately, that is all the time we have for questions today. We want to thank Celeste for taking the time to join us and share her thoughts on the threat to prison populations posed by the coronavirus. We also want to thank her for her continuing work on this important issue. If you're interested in learning more about FAMM's mission and their response to the COVID-19 crisis, you can visit famm.org for more resources. And remember to continue to educate yourself on the issues and also reach out to your legislators and volunteer when you can. I also want to thank my co-host, Keely Cassidy, for joining us today. Thank you all for tuning in. We hope you'll join us next time. Starting in June, EI Live is going to be airing every other Tuesday at 4 p.m. Eastern Time. We look forward to seeing you on June 16th to continue these important conversations.